It's another day with the physicians where your health is our business. It's growth towards the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what do you know?
You're welcome back to the training of your regular program.
The ovarian cyst in general, in a woman that you will be worried about, will be found in a woman who is menopausal, maybe 50 years old and above, and it's even worse when it's about 60 years old.
As formal national restrictions come to an end, people are beginning to reflect on the things that the COVID-19 pandemic has taught them about themselves. The COVID-19 pandemic lays out our lives bare and forces us to appreciate our most essential needs and our highest values. It forces us to appreciate the true value of many people whose roles in society tend to be undervalued. The nurses, the hospital orderlies, the people sitting at the checkout counters in supermarkets, the delivery personnel, the many nameless strangers who suddenly offer help to the old and vulnerable. The pandemic has revealed a vast sea of kindness and benevolence in our communities around the world. It has led to countless acts of selfless heroism in hospitals and care homes. It actually has impelled many of us to use our greatest strengths to serve our greatest purposes, suddenly giving our lives new inspiring meaning. This is the lesson that we must take into the post-COVID-19 world. The time has come to mobilize this goodness in our midst, rather than drive it to the sidelines through institutions and insensitive systems that reward selfishness and predatory competitiveness. Today on your regular program, The Physicians, we shall be talking on lessons from the pandemic. Stay tuned. It's another day with the physicians where your health is our business. Today we'll be talking about lessons from the pandemic. My name is Dr. Martina Agberie. I have with me in the studio my guest. She is a consultant of public health physician, a senior lecturer at the College of Medicine, University of Lagos. She is Dr. Oluchi-Kanma Okafor, and also a member of the Medical Women Association of Nigeria, Lagos State Branch. Doctor, you're welcome to our program.
Thank you. Thanks for having me.
Nice having you here. At last, you're on the physicians. So we're talking about the lessons from the pandemic. It's something that is very, very, very close to my heart. At least now that the restrictions have been brought down. In the past, you have a lot of mask here, social distance, wash this and do that. Now, at least we have a breather. They have said we can actually now relax a bit. But that does not mean we should throw caution to the wind. So let's hear from you as a consultant public health physician. Just give us a general overview first about the pandemic and before we now go into the lessons that are learned.
Thank you very much, Dr. Martina. So, as we all know, sometime towards the end of 2019, the world was, caught up in a very complicated, perplexing, and life-changing time when the COVID-19 pandemic that started somewhere in China spread to the rest of the world. It took the world a little bit by surprise, especially because nothing about that pandemic was what we had known before. Everything was new. And as with anything that is new, it took us a while to understand what was happening and how to adjust to it. But with time, you'd observe that people started to, with new knowledge and more evidence available, we started learning how to cope with it. So this pandemic spread across the world. And that's what characterizes a pandemic. When there's a health incident or a disease or a situation that crosses one country into another, crosses continents. So that's what characterizes a pandemic. And it happens in a measure that is completely unusual and affects people across this continent. So that's what happened. And so the world found itself in a situation where it had to learn to cope. And so we went through that time. We're still not completely out of it, but with knowledge and with understanding, we've come to a point where we have better understanding. We coped with some restrictions on the way we did things. We learned to protect ourselves, learned to adopt new habits, and then we learned to, carry on with life in spite of these. And so it generally changed the way we did a lot of things. And so from there, a lot of lessons have been drawn.
Okay, a lot of lessons have been drawn. The pandemic sort of upended our lives. Okay, so is there anything that we can actually, you can tell us now as a consultant, public health physician, you're also in the front line, okay? During this pandemic, most of us actually were on our toes, not sleeping. So what are the lessons? What do you think are the lessons learned so that for future pandemics that will be coming, we will not just be caught napping like it happened?
Okay, so the pandemic affected human beings at different levels. So we'll talk about the physical, when it came to our physical health. So some people got ill, some people may not have had the pandemic, or may not have had the disease, but they manifested some kind of disease or the other that was confusing to them. So we had the physical effects, the symptoms of the infection. Then we had the mental part where people had to do things differently. Life was different for them. Mental health issues. People were isolated. People were stuck at home. Children couldn't go to school. Life as we knew it was changed. Then we had the emotional aspect of it. Many people lost loved ones. Many people they lost their means of livelihood. Many people's lives changed. They were stuck in places where they wouldn't ordinarily be. Families were separated. People had to change the way they did things. Some people held on to their jobs, but they worked differently. They worked remotely. We had to become a Zoom world. Everything was about working remotely, virtual meetings. So it was completely different for everyone. But we learned to cope. Now, I would narrow down and say that maybe there are 3 core lessons to take away from the pandemic. The first one is that we should learn to prioritize our health.
We should learn to prioritize our health. That's the first lesson,
yes.
Okay?
Even when we're healthy, even now that we're not in the midst of it, people should learn to put their health in the front burner.
I always say people should put premium on their health.
Yes.
It's very important. Okay?
So take measures that will keep you healthy.
Okay.
Right from your nutrition, the way you sleep, the way you play, what you do, do the things you enjoy. Reach out to life and try to live the best life that you can. Make decisions that profit your health. Even as simple as deciding to have a regular medical check as frequently as it's possible. Things like that. So we should learn to place that priority on our health. Then the second thing I'll say is that we should stay informed, be informed. During the pandemic, a lot of people suffered because of lack of information. It's one thing to have information, it's another thing to have the right information that is based on facts and based on evidence.
Social media didn't really help matters during the pandemic because a lot of information was just flying out there, and even though they had told most people that go to the right source, CDC was there, WHO site was actually there, but most people kept putting fake news, and it was so scary. You know, it wasn't just okay. So people got really scared. At the stage, people even stopped using the social media as a source of information. Yes. You know.
Yeah, so that's important, being informed in the right way.
Okay.
And so we must learn to look to the right sources. Talk to your doctors. Go to the, like you mentioned, the NCDC website. Seek out the right sources of information and learn to move away from sensation. Because sensation many times will make us make the wrong decision. Some people during the pandemic, they didn't have COVID-19. But what they suffered was from the effect of taking the drugs that were told to them that would prevent the infection. So they did the wrong thing.
There was so much fear all over.
So much fear.
So much fear.
So that's the second lesson to learn.
Okay.
Get informed and get the right information. And the third lesson to learn is to embrace change. That time changed the way we did things. So many people are still stuck in that time, confused. They've still not found a way around normal life. But things have changed. Even the way we practice medicine has changed. When you get to the hospital, you're not going to see a doctor that might embrace you. You probably see a doctor that wear a face mask and have his personal protective equipment on him. So things have changed. The way we practice infection prevention and control has changed. So embrace change. Even when you will need to see your doctor, sometimes you might need to see your doctor remotely. Those approaches, telemedicine, we need to embrace them. The important goal is that we stay healthy. So embrace change. Embrace change when it comes to how you care for yourself, how you plan your day, plan your life. Embrace those changes. Okay. I think those are the three core lessons to take.
Okay, so let's take it down this route. Talking about the very important tool in public health, which is the mask. What do you want to tell us about how important the mask was during the pandemic? Even though some people didn't use a mask, but the CDC, WHO kept emphasizing the importance of masks. So what are the advantages actually of using the mask?
Even before now, in the past, the face mask has always been, it wasn't a new thing, although it seemed new to many people, but it's always been there. And what does it do? It prevents droplets from moving into our body when we have that barrier that allows droplets to not go directly into the body. Okay. So that's what the mask has done. It has given us that information or provided that opportunity for droplets that carry the infective agent to experience a barrier before entering into the body of the individual. Mm-hmm. And so the mask was a very important approach.
So with the mask, the importance of using of a face mask can never be overemphasized. So, and as a lesson, we are not hoping and praying for another pandemic, but the face mask is actually very important. It's the first thing that one should actually use when they say there's a pandemic or there is a challenge that has to do with health. Even doctors wear it, even without a pandemic, when they want to see patients, they wear it because it actually helps the part of the respiratory, preventing respiratory disease infection. We'll be back after, just hold on. When we come back, we'll deep dive more into some of the lessons learned during the pandemic. I'm sure you are enjoying what we are saying here about the lessons learned from the pandemic. We want to hear from you what you have to say. Yes, the restrictions actually been lessened, and social distancing is no more like before. But let's hear from you what you have to say. What lessons did you learn from the pandemic? We'll be back after the short break.
about COVID-19? Yeah, it started 2019.
It started in China in late December of 2019, if I'm right. But then we didn't take it serious. It was when it got to Nigeria then people actually took it serious. And that was around January 2020.
It affected my education more because I don't do business, so it didn't affect. But at home, yeah, we're not able to do a lot of things because of the lockdown and all. They said we should not move, so we could not do some businesses. That is my dad's business. But with me, for my education, at some point they told us not to go to school because of the COVID-19 issue.
And I could not go for events. I could not go to church. I could not do other things. Like it was just frustrating.
It affected me in my academics because I'm presently in my 4th year. I'm supposed to be in my final year. So, then we spent like 8 to 9 months at home doing nothing. So it really affected us as students.
We have to be careful in everything we do. We have to be clean. Yeah, it's one of the most important things. You have to be clean whenever you're around. Especially the sanitizer, you have to use it every time. Whenever, even without the COVID-19 problem, but learn to use your sanitizer to make you healthy and make you okay.
It's letting me personally to know that COVID-19 deals with you keeping safe, you being safe, using the nose mask, you watching your hands on time, you staying away from germs and other things.
We should just take our health serious because I could remember then, people didn't actually believe COVID-19 is real. So we don't have to first see something before we believe. So many people, I remember then when federal government declared lockdown, people didn't take the lockdown so serious like that. So it was after people, started catching it, that people now started believing it, that COVID-19 is real.
Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. We've actually been discussing lessons from the pandemic. And in the studio is a consultant public health physician. She's also a senior lecturer at the College of Medicine, University of Lagos, Dr. Oluchi-Kanma Okafor. We've been talking about lessons from the pandemic, and she has schooled us about the 3 different aspects, the things that we need to know, and she ended with the face mask, the importance of the face mask. Now we want to talk more about some of the other lessons learned from the pandemic. So now let's discuss telehealth. Because we know that during the pandemic, people were restricted at home. They were unable to see their doctors. Doctors were unable to see patients. Only the severe cases had to go to hospital. Even some that were ill couldn't go to the hospital. They couldn't access health. But then another method now came out, the telemed. Telemed has been there, but it became more obvious during the pandemic. So tell us, as a professional, what did you do? Using yourself as an example, how did you assess your patient? How did you reach out to them during the pandemic?
Thank you very much. To be able to successfully carry out telemedicine, it's important to have, first of all, have that channel, make it a simple one, and ensure that it's something that the patient can have as well as also making sure it allows enough interaction between the physician and the patient. So like you said, telemedicine is not new. It's always been there. But the situation like the pandemic created made it important to be able to use measures like that, system to flow.
Okay, actually, as a physician, what I did in my own for my patients, I actually had to use telemed, that same method in attending to them, because they will always want to see you, but you also have to be very wear your protective device if you are seeing them one-on-one. Otherwise, for those that couldn't come to the office, we had to use telemed in assessing these patients. Okay, going from that, what other lessons, the vaccines, the importance of vaccine, what did we learn from the vaccine? Because at the stage, immediately vaccines came, everyone was like, oh, thank God we now have vaccines. So what are the importance of using vaccine?
Yes, vaccines have, over the years, been very important in helping us control disease. Some diseases have been eliminated. Some diseases have been, completely taken care of because of vaccines. And so vaccines are a powerful tool. we remember the time when the vaccines first came out with a lot of wrong information. Some people were afraid of the vaccines, some people refused to have them outrightly, but the benefits of the vaccine cannot be overemphasized. It's immediately, helped people to be able to carry on with life to a certain extent. Travel became possible. That protection that the person felt when they were vaccinated helped even us health workers to be able to provide the care that we need to provide to our patients. So the vaccine was, a key, important aspect of the control.
Okay, so, and before we end, during the pandemic, most people, I'm sure, realized that health was not rendered to everyone equally. Okay, there were some people that were special that they had to attend to. Okay, so that was another lesson. So everyone is not treated equally during the pandemic. Is there any reason for that?
Well, yes. When it came to a situation like the COVID-19 pandemic, it was found that the elderly and people that had health that was already, vulnerable, for example, people that were immunocompromised and people that had comorbidities, were at a higher risk of having a more severe expression of the disease. And so these people had to be prioritized. Okay. Even health workers, for them to be able to carry on with work. When the vaccine came, health workers were given priority. And so, yes, if you say that not everyone is equal, at that time, that had to be done just to be able to protect humans.
Okay. So finally, let's talk about mental health. We need to take very good care of mental health seriously. I'm sure you have a book there.
Yes.
Can you just, what is it about?
Okay, yes. As outlined in my book, the book is titled Coping in the Time of an Infectious Disease Pandemic. In this book, I discussed extensively the effects of the pandemic.
Okay.
These effects go from emotional, psychological, starting from the physical, and the mental health of the individual. And even though everything we did was to protect people when it came to their physical health, the mental health of the individuals during the pandemic was key. The young people especially, the elderly, people that ordinarily receive care. Many of them were left alone. So we had a heightened number of suicides, especially among young people. And so that's what I outlined in my book. And this book was drawn out of the need for people to know about the pandemic, to be able to conceptualize what was happening, identify where they needed to be helped, and then find what to do. And so that's why this book came about. And so mental health, very important, and it's an aspect that we should always create room for when we have a health emergency like we just did.
Thank you very much, Dr. Oluchi. And on mental health, a lot came out during the pandemic, during the restrictions, because many people, parents got to bond with their children because they were home. A lot of negative things that was actually in operation that the parents did not know came to the fore during the pandemic, because they now realized that the children actually have some challenges. Depression, some children actually having cuts in their hands, trying to commit suicide. There was a lot of abuses at homes, okay? So but the pandemic brought a lot out, and of course the need to seek mental health. Thank you so much, Dr. Oluchi, for coming on our program, and to our viewers out there, I'm sure you actually enjoyed it. The pandemic is not yet over. It is not yet over. Just ensure you still keep the important things going. Wash your hands regularly. Try to maintain your social distance as much as possible. If you are going to a public place, if you can still wear a mask, it is still advisable that you still wear your mask. I want to say thank you so much for being part of our program today. Remember to follow us on our social media platforms, on YouTube, on Instagram, and on Facebook. If you want to be part of this program, just send us an email and we'll invite you to be part of us. For those who have missed past editions of The Physicians, we are live on YouTube. Just go to YouTube, check for The Physicians, and you will see us right there. Same time next week, we'll keep a date with The Physicians. Thank you for being there. My name is Dr. Martina Agbere.
My name is Doshima Bahabo, a community health nurse specialist. I just spoke about rape and told us how traumatic it is and how stigmatizing unfortunately for victims who are being raped. We need to support them in their communities and encourage them to speak out. Watch the physician periodically or whenever the show is on. I love it because it gives a lot of health tips. Thank you very much.